How do we influence patient decisions? And I think that's an area we spend a lot of time in, is trying to influence decisions in terms of trying to get a patient to maybe purchase a product, maybe agree to a therapy like dry eye treatment. And I think if we want to better understand how to influence patients' decisions, it's helpful to first understand how people actually make decisions. And I think if I were to ask a lot of doctors, they would point toward information. They would point toward patient education and making the patient more knowledgeable, sharing information with the patient. And that's all very important. But there's one flaw there, and it's that we don't depend on information as much as we do some other vehicles to help us make decisions. And in fact, 95% of our decisions are driven by more by emotions than by logic. And I think we spend a lot of our times educating patients and really trying to transfer information, transfer logical reasons to the patient, which again is important, but it often falls short of getting the patient to actually take action on that information. There's actually a very good reason for that. And I'm going to get into that. I'll explain that in the next video. But one way to make more of an emotional connection with the patient, I know you've heard me talk about this if you watch any of these videos before, is through sharing stories with the patient. So instead of just sharing a long list of logical reasons that a patient should do something, such as agree to maybe extended dry eye treatment plan, what if you were to share a story about a patient that they could relate to, just like them, who went through that therapy and the great outstanding outcomes that they had from going through that? Stories have a way of connecting with the emotional side of patient's brain, which again, that's where the majority of our decisions come from. So the bottom line here is, if you want to be effective at influencing patients' decisions, we really have to do more than just get them to think differently about what it is we want them to do. We really have to get them to feel differently. We have to do more than just make an intellectual connection with people. We have to become more effective at making an emotional connection with people as well.